relationship between ADHD, attention deficit hyperactivity disorder, and anxiety is a widely discussed topic, especially regarding the differences between them. Did you know that about 50% of people with ADHD might also experience anxiety symptoms? Indeed, the coexistence of these two disorders is quite common, yet it still generates many doubts and uncertainties. ADHD is generally characterized by concentration difficulties, hyperactivity, and impulsiveness. On the other hand, anxiety involves an excess of worries, tensions, and fears that are hard to control and significantly affect daily activities. The interaction between ADHD and anxiety can complicate matters even further. Imagine you have ADHD. This already makes it a challenge to maintain focus on tasks and activities. Now add anxiety to the mix. Your constant worries and fears can make it even harder to concentrate, creating a vicious cycle of stress and distraction. To illustrate, let's talk about Liza Koshy, a well-known media personality who openly shared her struggle with both ADHD and anxiety. She mentions how the combination of these disorders affected her ability to work efficiently and how she had to seek strategies to manage her symptoms. Liza's story shows us that, although challenging, it is possible to find ways to cope with both disorders. The main issue here is to understand that anxiety can be both a response to the difficulties faced by those with ADHD and an additional complicator that intensifies the symptoms of ADHD. This highlights the importance of treatment approaches that consider both aspects to help improve the quality of life of those affected. Understanding this relationship is the first step toward seeking appropriate help and developing effective management strategies. If you identify with these symptoms or know someone who might be going through this, remember that seeking the help of mental health professionals is crucial. While this gives an overview of the complex relationship between ADHD and anxiety. For those with ADHD and those suffering from anxiety, maintaining focus can be a daily battle, and understanding how each condition affects this can help us develop better management strategies. People with ADHD often find themselves extremely aware of everything happening around them. This might seem like an advantage, but in reality, this hyper-awareness often leads to distraction. Every little sound, movement, or even a subtle change in the environment can shift focus from what really matters. Imagine trying to concentrate on a task and every external stimulus seems as urgent as the task at hand. It's exhausting. On the other hand, anxiety also creates its own focus challenges, but for slightly different reasons. When someone is anxious, there's often an impulse to escape from negative thoughts or persistent worries. This can lead the person to seek constant distractions as a way not to face the thoughts that cause discomfort. This quest for distraction to avoid anxiety can manifest in compulsively checking the phone, endlessly channel surfing on TV, or even jumping from one task to another without completing any of them. The intersection of these two issues creates a fertile ground for frustrations. For those with both ADHD and anxiety, the world is a place where it's hard to stick to something for long without feeling the urge to move or the pressure of anxious thoughts. It's as if there's a constant battle between trying to focus and the desire to mentally escape. It's interesting to note that despite their differences, ADHD and anxiety share some common challenges like the difficulty in maintaining focus. Getting to know these conditions deeply is essential to seek the most effective management strategies. Anxiety is often characterized by excessive worry about the future. Those suffering from this disorder might find themselves constantly worried about what's yet to come, whether anticipating negative scenarios or fearing possible disasters. This state of alert can be paralyzing because the mind is always busy preparing to face threats that most of the time are imaginary. For instance, someone with anxiety might lose hours of sleep thinking about all the things that could go wrong in a work presentation days before it happens. On the other hand, ADHD predisposes a person to focus on the present, often seeking immediate gratification and short-term rewards. This means that instead of worrying about the future, someone with ADHD might have difficulty planning long-term or anticipating the consequences of their actions. The impulsiveness typical of ADHD makes the present always seem more urgent and important than any future plan. The combination of these two conditions creates an interesting contrast. While anxiety pulls the person out of the present with worries about the future, ADHD hampers organization and long-term planning, keeping them anchored in the here and now. This can generate significant internal conflict, as while one part of the mind wants to plan against potential future problems, The other part resists detaching from immediacy. People with ADHD often find difficulties in maintaining daily routines, including those related to health. This can be seen in the irregularity of eating habits, inconsistency with physical exercise, and difficulty in maintaining a regular sleep cycle. The impulsiveness and the quest for immediate gratification, common traits of ADHD, can lead to less healthy choices, such as poor diet and sedentarism. Moreover, anxiety can also significantly affect physical and mental health. The physical symptoms of anxiety, such as nausea, excessive sweating, and palpitations, are well known. Less discussed, yet equally important, is the impact that anxiety can have on life habits. For example, constant worry and stress can lead to behaviors like compulsive eating or, conversely, neglecting nutrition. The combination of ADHD and anxiety can create a vicious cycle concerning health. The impulsiveness of ADHD can make it difficult to adhere to medical treatments and healthy routines, while anxiety can intensify stress on the body and mind, exacerbating the symptoms of both disorders. This can result in a general deterioration of well-being, making it even more difficult for the person to recover or maintain a healthy state. An effective strategy to address these challenges includes implementing a structured routine, with regular times for eating, exercising, and sleeping. Moreover, therapies focused on stress and anxiety management, such as cognitive behavioral therapy, CBT, can help the person develop skills to better handle daily demands and reduce the negative impact of anxiety and ADHD on their health. It is also essential that the treatment involves professionals from different areas, including doctors, psychologists, and nutritionists, to ensure a holistic approach that considers all the person's needs. Thus, despite the challenges, it is possible to establish a healthier and more sustainable living standard. Starting with ADHD, impulsiveness and hyperactivity are classic symptoms. Impulsiveness in ADHD can manifest as difficulty in waiting for one's turn, interrupting others, or making rash decisions without considering long-term consequences. Hyperactivity is often seen as a nearly constant need for movement, a restlessness that seems never to cease, whether by incessantly shaking legs or constantly changing positions. On the other hand, although anxiety is not traditionally associated with hyperactivity, it can create a form of restlessness. Anxious people may experience a feeling of being on edge, which can translate into physical agitation. This type of restlessness is more a reflection of the internal tension and the constant state of alert caused by anxiety, unlike the uncontrolled energy typical of ADHD. The interaction between impulsiveness and hyperactivity in people who have both ADHD and anxiety can be particularly challenging. Impulsiveness can be exacerbated by anxiety, increasing the likelihood of reactive and rash behaviors in stressful situations. Additionally, physical hyperactivity can be intensified by anxious states, resulting in a person who feels driven to move constantly as a way to relieve their psychological tension. Managing these symptoms requires a multifaceted approach. Behavioral strategies might include relaxation techniques, such as deep breathing or meditation, which help control agitation and impulsiveness. Therapies focused on impulse control, such as behavior modification therapy, can be very helpful for people with ADHD, while anxiety coping strategies, such as gradual exposure to anxiety triggers, can be beneficial in reducing anxiety-related restlessness. In the context of anxiety, social withdrawal can be a natural response to the fear and discomfort that interactions can provoke. People with anxiety disorders often avoid social situations for fear of being judged, feeling anxious or fearful about how they will be perceived by others. This isolation can be a way to control the environment and reduce anxiety sources, but paradoxically, it can also aggravate the feeling of anxiety in the long run, creating a vicious cycle of loneliness and fear. In ADHD, social dynamics can be complicated in a different way. Impulsiveness and difficulty in regulating behaviors can lead to interactions that are perceived as abrupt or insensitive by others. Additionally, many people with ADHD experience what is called rejection dysphoria, an exacerbated sensitivity to rejection that can make negative social experiences felt more intensely. This sensitivity can cause individuals with ADHD to socially withdraw, to avoid the pain of perceived or real rejection. The combination of ADHD and anxiety can make social withdrawal even more complex. The person might feel constantly on alert about how they are perceived, anxiety, while struggling to behave in a socially acceptable manner, ADHD. This can be extremely draining, both emotionally and physically, often leading to isolation as a form of self-protection. To address these challenges, it is crucial to develop strategies that help the person feel more secure in social interactions. Therapies such as cognitive behavioral therapy, CBT, can be very effective, as they help the person challenge and reframe negative thoughts related to anxiety and the perception of rejection. Support groups and group therapy can also be beneficial, as they provide a safe environment where the person can practice social skills and receive feedback in a supportive and understanding context. Other symptoms frequently manifest in ways that permeate all aspects of daily life, influencing work, personal relationships, education, and personal well-being. On the one hand, constant anxiety can be a sign of generalized anxiety disorder, characterized by excessive worries that are difficult to control and that significantly affect a person's ability to function normally. These worries are accompanied by physical symptoms like muscle tension, fatigue, and sleep problems, all contributing to a continuous cycle of anxiety. On the other hand, frequent activity and impulsiveness might indicate ADHD. These symptoms not only make it difficult to concentrate and accomplish tasks, but can also lead to hasty decisions and relationship problems due to the impulsive nature of interactions. The complexity of dealing with both disorders simultaneously can make the symptoms seem inescapable. The interaction between hyperactivity and anxiety can increase the feeling of being constantly under pressure, with no relief. This can be extremely exhausting, both mentally and physically, which is why getting a correct diagnosis is so crucial. A professional diagnosis is not just about labeling a condition, it's about understanding the extent and interaction of the symptoms so that an effective treatment plan can be developed. Mental health professionals, such as psychiatrists and psychologists, use a variety of tools and tests to assess ADHD and anxiety, ensuring that the treatment addresses all aspects of the disorders. It's essential that people who suspect they might have ADHD, anxiety, or both seek professional help. An accurate diagnosis can open doors to suitable treatments, such as medication, cognitive behavioral therapy, and stress management strategies, which can significantly improve the quality of life. In summary, while the symptoms of ADHD and anxiety might often seem inescapable, the path to relief begins with recognizing the need for professional help. This step is fundamental to breaking the cycle of symptoms and starting a journey toward a more controlled and satisfying life. The important thing is to recognize that there is no shame in seeking professional help. Often, social stames and misunderstandings about mental health can prevent individuals from seeking the necessary support. It's vital to understand that both ADHD and anxiety are legitimate clinical conditions that require medical attention, just like any other physical illness. If you or someone close is experiencing persistent symptoms of anxiety or difficulties associated with ADHD, the initial step should be to consult a mental health professional. This might include a psychologist, a psychiatrist, or a general practitioner who can refer to specialists. These professionals can offer accurate diagnoses and personalized treatment plans that might include therapy, medication, and coping strategies tailored to your specific needs. Remember, you are not alone in this journey. There are resources and people ready to help. I hope this information has been helpful and encourages you to take the necessary next steps. Thank you for taking the time to learn more about these important mental health topics. If you have further questions or need more information, do not hesitate to seek out. We are here to help.